I'm Dr. Matt Hand. I'm the Chief Medical Officer for Square One Health. And one of the things that we started to look at was how do we make a change? How do we look at things that can improve cardiovascular health? And from a Western medicine standpoint, there's lots of medications we use and they're commonly used throughout all the cardiovascular treatment options that are out there. And they're important. But most people are asking, well, what else can I do? Is there other things that I can do to improve my outcome? When I'm going down this healthcare journey, how do I make a difference in that journey? Not just medication wise, but from other things that I can do and other things that have been proven to be beneficial. We know that movement and food and all of that is really critical for important cardiovascular health. We also know that there are things that we can use on a day-to-day basis that can change that. And at Square One Health, we decided to look at a number of different products, a number of different supplements and botanicals to see what actually makes a difference. What has been actually shown to change vascular tone and improve vascular tone. Not only improve vascular tone, but ultimately have an impact on our cardiovascular health. And when I talk about cardiovascular health, I'm not just talking about heart and brain. That's what everybody assumes. Vascular health involves all organ systems. It involves your kidneys, it involves your liver, it involves your pancreas. Literally every single organ system is involved in vascular health. And we know that when vascular tone is better, we know when there's lower inflammation in the blood vessels, that ultimately is a critical component to improving your health. So we took a step back and said, well, what can we do and what can we do different? What can we do that actually is shown to be effective? And what can we do that can be deliverable to people so that they can start this healing journey from their overall wellness? So we started looking at certain things. There are a number of things that have been used for quite some time that have been shown to improve the cardiovascular outcomes and health for patients. Coenzyme Q10 has been one of my favorite for years. It's called ubiquinone. It's in every cell in the body. It has a number of different physiologic mechanisms that help it to change vascular tone, to improve a number of different parameters from when it comes to overall health. And it's incredibly well tolerated, which is one of the real beauties of it. So we knew that was one that was really important. It's important in nitric oxide production. It's important in vascular tone. So we wanted to make sure that we were using something, some CoQ10. The second thing was magnesium. Magnesium is a smooth muscle relaxant. It's been shown to help in a number of different ways to help with vascular tone, to help with overall health and wellness. And we said we needed to include that to help to control some of the things that we wanted to have to improve our long-term outcome for our patients. We also knew that one of the more important things was how to change nitric oxide. So nitric oxide I became very interested in back in the early 1990s. I was actually working in a research lab, and I was doing work in pediatric intensive care and looking at kidney failure. And at the time, nitric oxide was actually named the molecule of the year because of its impact on blood vessel tone. And then the people won the Nobel Prize for their identification in nitric oxide and its potential outcome you can have in terms of if you can improve nitric oxide in the body. Interestingly, we knew it worked when we gave it to people with lung disease. We have them inhale it. It changes the blood perfusion. But finding a way to get it to somebody from a non, IV therapy of some sort, or I should say inhaled therapy, was really hard to find. We knew that nitric oxide was critically important and produced through the plants and a lot of the plants that we ate. We knew that the body had to be able to do that. And finding something that could actually change nitric oxide level and change vascular tone in the body was critical. And we were fortunate enough to find a particular product called S7. S7 is a series of different plant products that, when taken, significantly increase nitric oxide in the body. This is really a game changer. Having the ability to do that is and not just have it theoretically happen, but actually have it in clinical studies that shows that it changes that vascular tone is something that S7 was able to do. So we decided to sit down and take all of these things. So we took potassium nitrate, which has been also been included to use to increase nitric acid. It's been used to help with blood pressure related issues. We also took the coenzyme Q10. We took the magnesium. We took the S7. We put all these things together into a single capsule, and looking at this are going to use it to help people who are traveling this cardiovascular journey. We call ourselves Square One Health because we're starting from square one. We're looking at what can be added to our healthcare journey from square one to improve the long-term outcome. I have a statement that I use all the time, which is if you simply look at the single leaf of the tree, you miss the beauty of the thousand leaves. And we get very focused sometimes on individual components of what goes on within our health, when actually the most important thing is not focusing on the leaf, but focusing on the tree. The healthier the tree is, the less the leaf is a problem. So our goal with Square One Health is to use this product, CardioQmag, that includes these proven substances that change nitric oxide levels, that actually changes vascular tone, can improve cardiovascular outcome, and put them all together in a single product. So if you simply look at the single leaf of the tree, you miss the beauty of the thousand leaves. If you're ready to start your journey and go down the cardiovascular health pathways, or path, if you will, more importantly, if you're dealing with anything that involves health related to blood flow, this is what we are putting together so we can help people to move forward in their overall healthcare journey.